This is a show about the diversity of academic and experiential backgrounds of people working in patient safety. My name is Ivan. I am a lab rat turned infection preventionist. While struggling to find work, I reached out to a friend for support. Our chat turned into a LinkedIn post that showed me that many people in our field were in the same situation. The purpose of the Safety Spectrum podcast is to celebrate credential, educational, and experiential diversity, to share the values and success stories of non-traditional staff in quality patient safety and infection prevention, to advocate for competency-based versus credential-limited hiring, and to increase awareness of the importance of the infection preventionist and other roles in the healthcare safety sector.
In this episode, I talked to Chaz Rhone, the VP of Infection Prevention at HCA Healthcare North Florida Division. Chaz has over 18 years of experience in acute and long-term care. He's an advocate for the candidacy of public health graduates in IP positions. In my opinionated opinion, Chaz is the best-dressed man at every APIC national conference I've ever attended. Welcome to the Safety Spectrum.
Today's guest is Chaz Rhone. So Chaz, welcome to the podcast.
I'm so excited to be here. Thank you. Appreciate the introduction.
Absolutely. So before we really dig in, I do want to say the several times that I've seen you at APIC National, in my opinionated opinion, you are the best dressed guy there. And I noticed that because I'm trying to get into that ranking. Who's your stylist?
Hey, I do it on my own, and it's kind of my personal expression, I guess. I'm an introverted person, so I guess it's a way to kind of put myself out there a little bit, spark some conversation maybe. But also, if you look good, you feel good. So that's kind of my motivation to do it as well. So that's kind of my thought behind that. But I appreciate
wonderful. All right. So you are a recognized leader in infection prevention, and your background, the main story, I think, is your background in public health, educational training, and I think your internships were in a public health setting. But you just decided to get your foot in the door in a hospital, and thanks to a recommendation from someone. Tell me about that.
Yeah, so my journey is probably atypical for someone from the public health background. I actually started my career in infection prevention, which I think is extremely rare, especially around the time that I was graduating and kind of getting into my career. And so, again, I graduated with a master's in public health and epidemiology. The only way I learned what IP was is that there was a student in the class ahead of me. And we all know we need to do a capstone project as MPH students. And so they would allow us to sit in on those talks to get ideas about projects that we could do when it came our time to do our capstone. And so I heard a colleague of mine talk about his internship in the hospital, and he interned with the infection prevention department and some of the things that he was working on there. And so I've always had a passion for healthcare. I just didn't know exactly where I would want to work or what lane that I would want to be in. And, we all know about nursing and doctors, but, no one ever knows about IP or even some of the other functions in the hospital that I've come to learn about in my career. But long story short, I listened to his presentation. I was fascinated, knew I wanted to work in the hospital in some capacity. So I kind of followed in his footsteps. And in fact, ended up interning with the same preceptor that he had. And so I got my foot in the door there, did about 3 months of work there, really enjoyed it. And then, because of connections and people positioning and advocating for me, I was able to apply for a job on the heels of that internship and the preceptor was able to vouch on my behalf to help me make my way into the IP field. So,
Wonderful. So my background is lab. There were times when I wore scrubs, and you go out after work, go to the grocery store or whatever, and it was always interesting because people would ask you, "Are you a doctor or a nurse?" Like those were the only two options. So yeah, um, wonderful. So in in all of your work, one of the things that we the general public know you for is your advocacy for IPs coming from public health, IPs coming from non-nursing backgrounds. And one of the ways that you have done that is working with APIC on, is it an education or career pathway?
yes, it's called the Academic Pathway for Infection Preventionists.
Uh-huh.
Yeah. And so this is probably one of the most exciting things that I've had the opportunity to work on in my career. And basically, what we did was this was in, I think, 2020, 2021. We put together a group of IPs, and it was headed by myself and Rebecca Bartles. Her last name's different. She's gotten married since, but she also runs the Center for Research at APIC now. So at the time she was an infection preventionist, she also is from the public health realm, and we both were passionate about making sure other MPHers or those from public health, as well as those responsible for hiring IPs and just our field at large, are aware that public health IPs are also IPs, and their educational assets that they bring to the table are very beneficial to what we do in infection prevention. And so we were kind of tapped to head up this task force, and the goal was to produce educational pathways or degrees even for IPs to go to school to become an IP, because that doesn't really exist at large right now. And so first we started off with, what do we want to accomplish? And the goal was to create a certificate program. So for instance, if I'm a nurse and I'm graduating with a nursing degree, I can also get a graduate certificate in infection prevention to kind of attach to my nursing degree that would position me to become an IP. But really, any educational pathway, you could partner with that graduate certificate, and then that would set you up on the IP pathway. We also wanted to work on a bachelor's degree in infection prevention, as well as a graduate degree in infection prevention. So those are sort of the three products that we focused on developing.
Has any of that been implemented yet?
Yeah, so it has been released out into the wild. And so there are several ways that you can use what we produced. Actually, there were 4 products that we created. The fourth one was a framework for an IP internship. So any facility could take this. I think it's a 12 or 16 week structured approach to interning as an IP and all of the things you would want them to be involved with. And so it's on the APIC website. You can go take a look at that. It's all nice and packaged up. There's been more focus on getting the internship piece up and running. The engagement with universities, we are still working through that process to make them aware of what's out there. And the goal of this information is to give universities a guideline in terms of, here are the courses that you need to have. Many universities already have a public health program with a lot of these courses in them, but it's how do we repackage those courses to be able to provide a degree specifically in infection prevention? How can we tweak what we have? And so we're in process of engaging universities and making them aware that this exists so that they can also launch programs for bachelor's degrees, master's degrees, and also graduate certificates for infection prevention.
That is wonderful. I did not know about infection prevention before I started working in infection prevention. So there is a lot of opportunity there. And I can attest, and I'm sure you can too, how much we have to explain what we do whenever people ask, so what do you do for a living? I'm an infection preventionist. What is that? So I think it's brilliant to develop these pathways. So that leads me into my next question. Knowing what you know now, what would you have done differently? What would you tell young Chaz to kind of smooth his way?
Yeah, and so, because my experience was a lot different, so I started my career as an IP, whereas most don't. My answer is going to be a little bit different for me personally. So I'll give my personal answer, and then I'll give an answer to those who are trying to make their way in. But for me personally, I wish that I would have invested more in leadership development early on in my career, as opposed to kind of waiting to get into leadership positions. And I think, by and large, as IPs, when we're first getting started, there's a lot of technical expertise and things that we need to learn about the medical field and the clinical space, and even our tactics in terms of how we prevent HAIs. So there's a lot of focus on the technical piece of our job, the how-tos and the information that we need to know. But because of how our role functions, we touch basically everything in the hospital or in the healthcare setting if you're not in acute care. And so you really need to develop those leadership skills so that you're able to communicate, you can collaborate, you can lead a group of people around a common cause, you can advocate for resources. And so there's a tendency to focus earlier on in your career on those technical pieces, and then we figure out the leadership pieces along the way. But for me, I wish that I would have known better and been more intentional about developing those leadership skills, because as IPs, we are leaders, whether we're the AVP of infection prevention over 15 hospitals or we're just starting out as an IP. There is still leadership capability that you need to develop for you to be successful in your career. So personally, that's what I would tell young Chaz. I think for those who have recently graduated, or maybe they're currently working in public health and they're trying to make their way in to infection prevention, I would say you need to know what strengths you bring to the table as an MPH or someone from the public health background, and how those strengths would benefit an infection prevention program. And so one of my favorite papers that was written is in 2019. One of my colleagues from early in my career, Kelly Boston, was a co-author there. And what they did was they took the APIC competency model and they superimposed the competency model or the curriculum for epidemiologists, graduate level, on top of the APIC competency model. And what they found was that there's about an 80% overlap of competency versus curriculum for MPH. And so I thought that was very eye-opening for public health, to understand, hey, I'm walking out with a graduate degree and I've already touched 80% of what I would need to experience, to be a successful IP. And so that's my strongest advice, is know what know what you're capable of, and look at the APIC competency model and look at how your experience overlaps that competency model.
Do you think that we are having these conversations with the right people?
Yes, that is a great question. So it's not just the IPs that we need to talk to, or those trying to break into the field, because we need to teach them how to position themselves and how to find their way into IP. But the other side of that equation is those that are hiring IPs. And so, I've given several lectures in front of an IP audience that includes our other partners, so nursing and microbiology and some of the other educational backgrounds. And you will always hear me challenge those that are responsible for hiring IPs to think outside of the box. And research shows, as people hiring others, we tend to want to hire what we're most familiar with or what we are. And so we have to get rid of that bias and kind of think outside of the box. And so one of my goals is educating not just those from the public health background, but also nursing, because again, they make up the largest part of our IP workforce, and they're probably doing most of the hiring. They need to understand also what we bring to the table. We all know that finding experienced IPs is getting harder and harder to do. And so if we're shrinking the pool down just to nursing or specific educational backgrounds, public health is a whole arena of candidates, a bigger pool that we're missing out on. And as I mentioned before, we've touched 80% of what you would need to know foundationally to become an infection preventionist. So not just educating the public health background and those trying to find their way in, but making sure our colleagues at large who are responsible for hiring understand what a public health candidate can bring to the table or add to their program as well.
Okay, don't forget the lab rats. Lab rats are cool too.
Absolutely. And to your point, there is also another paper that a colleague of mine wrote. I think his was in 2021. He also has a lab background, and he did the same thing. And so he superimposed the curriculum for lab and microbiology on top of the APIC competency model. And I think he found a similar 80% overlap as well. And the overlap's probably in a little bit different areas than it would be for public health, but nonetheless, we still have that foundational education to be able to walk into a role and be successful. And we're not going to know everything, but we're going to have the concepts that we need as the foundation to build on.
And I honestly do not think that nurses who start out, a nurse starting in IP knows everything either. As I have grown in the industry, my hope has been that our certifications would serve as an equalizer to where, a CIC or an ALCIP or, any of those certifications would minimize the MPH or the Bachelor of Science in Medical Technology or the BSN. What do you think of regarding our certifications as equalizers, and is that something that's panning out, or it's still an ambition?
Yeah, I wholeheartedly agree with you on that. I think, again, the certification should be the ultimate equalizer to say that you have adequate foundational knowledge to be successful in IP, regardless of your educational background. As you mentioned before, a nurse is not a nurse is not a nurse, even within the hospital. So you could have a nurse with an OR background. You could have a nurse with a cardiac background. You could have a nurse with a pediatrics background. But if you took a pediatric nurse and you put her in the OR or him in the OR, they would probably feel like a fish out of water. There would be things that they need to learn about that setting. Of course, the foundational principles of nursing still apply, but the application may be different based on the setting that they're in. And there are nuances that they need to learn. So just because you're a nurse and you have a clinical foundation, when you move into IP, there's lots more to IP than the clinical picture. And so there's data management, there's project management, there's leadership development. I do think it's fair to acknowledge what each educational background may bring to the table. So obviously nursing is going to bring a strong clinical perspective to the table. But when you think about microbiology, they're going to bring that knowledge to the table that nursing may not specifically have. And then when you bring in MPH, you're going to bring kind of a system or community approach. You're going to be bringing in outbreak investigations. You're going to be bringing in data analysis and management. So some of the other things that a nurse may not have experienced specifically in their clinical setting. And so regardless of the educational background, we all have gaps that we need to compensate for when we become IPs. But the certification should say you at least have the foundational knowledge regardless of your educational background to be successful in the role. And so I completely agree. I don't even well, we should consider the educational background to understand what that candidate may be bringing to the table. But in terms of assessing their foundational knowledge of IP, that certification should speak a little bit louder than what their educational background is.
Absolutely. I was hired by a nurse who worked with someone from the lab. And she enjoyed that collaboration so much because microbiology was not one of her strengths. And so shout out to Becky Brubaker. When she hired for her second IP position, she specified that she needed someone with a lab background. And we worked very well together. I learned a lot from her. She learned a lot from me. And as I have connected with other IPs, I find that the best teams have that diversity of educational backgrounds. As you said, the nurse brings a lot of the clinical background, lab brings a lot of the microbiology and microbiology background, and then the MPHs are bringing data analysis and just that wide look, surveillance, outbreak analysis, and things like that. So yes, another plug for diversity, right? In all of its many forms.
And I mean, that's a part of
Wonderful.
my personal story, even. And so, kind of going back to how I would coach, those from public health trying to get into the field, knowing those strengths. And so that was exactly my approach when I applied for my first role as an IP. In fact, the job posting asked for a nurse, and I applied anyway. So a couple of things there is to have someone who can help advocate on your behalf. So if there's, an acquaintance or, someone that who you have worked for, that knows the person where you're trying to get hired, I would definitely take advantage of those relationships. So networking is going to be essential if you're trying to get into IP. Because this is what needs to happen. We have to be able to get around the HR system sometimes because it's designed to weed out candidates that don't meet the minimum requirements. And so if the minimum requirement requires a degree you don't have, you're probably not even going to get in front of a human. So how do we get around that? And so I was able to circumnavigate that because of my preceptor. I was able to send my resume directly to the person that was going to be hiring. And then when I got the interview, I highlighted the skills that I would bring to the table as someone from the public health background and how that would show up in infection prevention. And the medical director who I was having that part of the discussion with, wasn't really familiar with those from public health being an IP, but he was fascinated because I was able to speak the language and articulate how my skills could enhance their program. And so, again, it's just very important to understand what skills you bring to the table and how they can support an IP program.
Talking about the HR system, you as an assistant vice president, are you able to, within your organization, start to affect that HR system?
Absolutely. And so this is, again, another advice to those who are responsible for hiring IPs. What I found when I got into my role is a lot of my facilities that I work with. So I oversee 15 hospitals, and not all of them, the IP directors locally, were aware of even what their job description said, or even the criteria used for hiring. So they would have a vacant position. It would get posted, and just because of who I am, I would go to the posting and see what it is they're asking for and say, no, we hire all educational backgrounds in our division. Why is this saying a nursing degree is required? That's not correct. And so part of that work was going to every facility and making sure they all have the same job description. And so that when positions got posted, we were all abiding by the same criteria in terms of what candidates we were looking for. And so, again, if you're responsible for hiring IPs, you need to get with HR and understand what's in that job description. And you need to be specific in terms of what you're looking for in your candidate. And then I tend to tell them I want to see, 90% of all of the applicants that apply because there may be an educational background that I never considered or a missing piece to my team that I'm looking for, even from a project management, position. Or respiratory therapy is another one that's not always as popular in IP. I've even known of pharmacists coming into IP. And so if we were eliminating people based on their educational background, we could be missing out on great IPs out there that, again, their educational knowledge brings an asset to the program. So definitely get involved with HR, advocate for what you want to see on your team, and make sure they understand that IPs can be more than just a specific educational background.
So to summarize what you have said and make sure that I understand it correctly, the key there is for the IP lead to work on creating a job description that encompasses all of the candidates that they would like to hire. It's not something that comes from HR. It comes from IP leaders, correct?
Correct.
Wonderful. Burnout is everywhere now. What are your own kind of ideas and responses to the strain of IP work?
Yeah, I would.
How do you stay sane?
Yeah, I would. So again, I think I'm a little different than most IPs that I meet. Most IPs that I know are type A personality. I'm type B, so I'm very laid back. I'm not very reactionary at all. I like to have the information as much as I can before I make a move, make a decision, or take any action. And so I think, because IPs tend to be type A, they're really ambitious about their work, and, they want to be good and they want to be successful. They want to cover everything. They don't want to leave any loose ends out there. Whereas I'm on the opposite end of the spectrum, and I'm like, okay, who can I partner with to get this done? Because I know that I can't do this all by myself. And so, kind of going back to the team balance, we talked about that in terms of educational backgrounds. I think you also need to have a balance of personalities so that we can encourage each other to do what we need to do, specifically around burnout even. And so, for me, when I go on site with one of my IP directors, we're going to hit the ground running. These are the things we're going to round on. This is everything we're going to look at. These are all the meat. So they'll have an agenda for me already. And I'm the one that's saying, can we just sit and talk? Like, how's your family? How's everything going? Around lunchtime, They always know I'm probably going to be the one to say, I'm hungry. Can we stop and eat? They're not even thinking about that. They're just thinking about the next thing that they need to get done. I'm always challenging them to be human. Like, talk about yourself, talk about your family. You need to eat, thinking of Maslow's hierarchy of needs. You need to eat and do some of these things to be successful. And, it should be normal for you to leave when it's your time to leave for the day. If you're not leaving on a regular basis at the time that you need to leave, there's an issue. And so are we collaborating? Are we taking advantage of our partnerships, or are we kind of hoarding the work and doing it all? So is there opportunity to do that? But, just strongly encourage people to meet those needs that make us human. Our work is always going to be there. There's always going to be more that needs to be done. We have to prioritize, obviously, what needs our attention right now today before we can leave for the day. But there are things that we don't need to address right now today before we leave. And so, I'm really a strong advocate for this is not emergent. So just take your time. I encourage my IPs to take time off. I always try to incorporate like personal conversation, like tell me about your family. How are your kids doing? How did you sleep last night even? Whatever, just to kind of bring it back to a more human approach, and that it's not just all about, the business that we have to take care of when we're in the hospital or, whatever organization you work in. So those are kind of, in a broad conversation, my ways to get around burnout. And, again, that type A versus type B personality, I think we really help to balance each other out.
That's wonderful, especially to hear from someone in a leadership position. Many IPs feel the strain of needing to push because of what is coming down from their leaders. So I'm confident and I hope that the IPs that you work with recognize just, how unique and brilliant you are to bring that to them, to bring that into their teams.
But that's why I talked about, earlier on, those leadership skills are very important to not only know that it takes a village to do IP, but how do you start those conversations? Who do you go to? How do you get their buy-in so that you're not carrying the load by yourself? So if you find yourself in a place where you don't have a leader that's encouraging you to do those things, or positioning you even to do those things, you're going to have to do the work yourself. And so it's really important that you understand from a leadership perspective, how do I get more hands to help me accomplish the things that we need to accomplish? And really keeping our patient at the center is the reason that we're doing this. So how do we do this as a team with a common goal to get the best outcome possible for our patients? So to me, that's what burnout, really boils down to, is taking advantage of your team and your resources so that we're not carrying the weight solely by ourselves as IPs.
All right. What exciting thing are you working on? I don't know, what fun thing do you want to share with our listeners?
Personally, for me, right now, I have two young daughters. They are 7 and 10 right now. I had to think about their ages because they are growing so fast. So a lot of my time centers around just being dad, being present, being at their lessons and their recitals and, those things. So I find great joy in just being present as a father for my family, despite my busy work schedule and the traveling that I have to do. So that's probably what consumes my time the most. So I try to find time to work out. So we talked about burnout and, just meeting those human needs. So that's, if I'm not, doing stuff with my family, I'm trying to make sure that I stay healthy so that I can be around longer with my family. So that's kind of on the personal side what I'm working on right now.
That is wonderful. I have two nieces, 5 and 8, I think, and I was in trouble the last time I went to visit them because I missed a few recitals. So, yeah, absolutely. We have to make time for our families, or else what's the point, right? Uh, Wonderful. Well, Chaz, it has been an absolute pleasure talking to you. Thank you for what you're doing. Thank you for being on the show.
Absolutely. I've enjoyed the conversation and I look forward to meeting you in person as well.